Stop. Before you schedule that prostate exam or resign yourself to adult diapers, I need 8 minutes of your time. Because what I'm about to tell you will sound impossible, but it's going to change your nights forever. I'm Dr. Leonard Brooks, a geriatric physician with 35 years of experience treating seniors, and I've seen thousands of patients, good people just like you, stumble into my office exhausted, frustrated, and convinced their bladder is broken. They've tried everything. They've cut back on water. They've scheduled bathroom trips. Some have even considered surgery. And here's what breaks my heart. 95% of them don't have a bladder problem at all. Let me ask you something personal. How many times did you get up last night? Once? Twice? 3 times? More? Now, here's the question that's going to change everything. What if I told you that every single time you dragged yourself out of bed, stumbled to the bathroom in the dark, and stood there waiting for what feels like the world's smallest trickle, your bladder was just following orders from a completely different part of your body? What if the real problem isn't below your belt at all? I know that sounds crazy. You're probably thinking, Dr. Brooks, I literally feel the urge in my bladder. How can it not be my bladder? Stay with me, because in the next few minutes, I'm going to show you the real culprit, a tiny chemical messenger in your body that's been thrown completely out of balance. And once you understand how to fix it, you're going to sleep through the entire night. Not most of the night, the entire night. I've used this exact protocol with patients in their 70s, 80s, even their 90s, people who hadn't slept through the night in decades. And within days, sometimes even the very first night, they're waking up amazed that they didn't have to pee even once. So if you're tired of being tired, if you're exhausted from interrupted sleep, if you're frustrated that your bladder seems to have a mind of its own, keep watching, because this isn't about managing the problem. This is about eliminating it completely. Now, before we get into the solution, I need you to understand something critical. The real danger here isn't the peeing itself. It's what those bathroom trips are doing to your sleep. And with poor sleep, you're not just tired. You're setting yourself up for a cascade of serious health problems. Let me paint you a picture of what's happening inside your body every single night you get up to pee. First, your sleep architecture, that's the natural cycle of deep sleep, REM sleep, and light sleep, gets completely destroyed. Your brain never gets into those deep restorative stages where it repairs itself, consolidates memories, and detoxifies. This is why you wake up with brain fog. I had that really badly myself years ago, and I'll tell you more about that in a moment. But it gets worse. When you don't sleep properly, your metabolism goes haywire. Your body literally loses its ability to regulate weight effectively. I've seen patients gain 15, 20, even 30 pounds, and they're doing everything right, watching their diet, trying to exercise, but the weight won't budge. Why? Because they're not sleeping through the night. Your cortisol levels shoot up. Cortisol is your stress hormone, and when it's chronically elevated, it does terrible things. It increases visceral fat. That's the dangerous fat around your organs. It keeps you in a constant state of hunger, which is why you find yourself wanting to snack all day long. You're not weak-willed. Your hormones are screaming at you to eat. Sleep disruption also puts you at significantly higher risk for type 2 diabetes. It creates something called insulin resistance, which I'm going to talk more about later because it's actually one of the root causes of your nighttime urination. It's a vicious cycle. Poor sleep causes insulin resistance, and insulin resistance causes you to pee at night, which causes poor sleep. Around and around you go. Your blood pressure goes up. Your arteries become stiffer. Your risk of heart disease increases. Your mood plummets. Anxiety and depression become constant companions. Your cognitive function suffers. Focus, memory, concentration, all of it deteriorates. And for men especially, testosterone levels drop through the floor. And of course, you're exhausted all day long. You're dragging yourself through life, reaching for coffee after coffee, just trying to make it to bedtime so you can get up multiple times to pee again. It's a nightmare, literally. Now, here's what's really interesting. There are cultures around the world, places where people routinely live into their 80s and 90s, where people sleep through the entire night. They're not getting up at all, not even once, But in the United States, 1 in 5 men and 1 in 4 women get up at least once or twice to urinate every single night. Some studies suggest the numbers are even higher. So let me be absolutely clear about something. Aging is not the problem. I know your doctor might have told you, well, you're getting older, this is just part of life, you'll have to live with it. I've heard this story 1,000 times from my patients, and I'm here to tell you that's absolutely wrong. Yes, some things change as we age, but peeing multiple times a night is not an inevitable part of getting older. It's a sign that something specific is out of balance, and once you fix that imbalance, age becomes irrelevant. I have patients in their 90s who sleep like babies through the night, and I have patients in their 40s who are up 3 or 4 times. The difference isn't age, it's what I'm about to show you. All right, here's where we get to the heart of the matter. There's a hormone in your body that most people have never heard of. It's called antidiuretic hormone, or ADH for short. Now think about what that name means, antidiuretic. It means it's anti-you urinating excessively, especially through the night. This hormone is your body's master regulator of water balance. When ADH is working properly, it tells your kidneys, hey, we're sleeping now, hold on to that water, don't make so much urine. Your kidneys listen, they concentrate your urine, and you sleep peacefully through the night. But when something throws off this hormone, when ADH stops working the way it should, your kidneys just keep making urine all night long. They don't get the message to slow down, and that's when you find yourself making those midnight bathroom trips. So what throws off ADH? What disrupts this crucial hormone? That's what we're going to dive into right now. And I'm warning you, some of these triggers are going to surprise you. Some of them you're probably doing every single day without realizing the damage they're causing. Trigger 1, the salt and potassium imbalance. The first and one of the most common problems I see is an imbalance of too much salt and not enough potassium. Now, I'm not going to tell you salt is evil. You need salt, but the ratio matters tremendously. And in the modern diet, we're absolutely drowning in sodium while we're starving for potassium. When you have too much salt relative to potassium, it directly affects your kidneys and disrupts ADH. Your body recognizes that there's excess salt in your system and it wants to get rid of it. So what does it do? It produces more urine to flush that salt out. Even at night, even when you desperately need to sleep. Here's how to know if this is your problem. Do you have fluid retention in your legs? Press into your lower leg, ankle, or foot. If it leaves a dent, if that indentation stays there for a moment, you have edema, which is fluid retention. And here's what happens at night. When you're standing and walking around during the day, gravity pulls that fluid down into your lower extremities. But when you lie down horizontally in bed, all that fluid gets reabsorbed back into your bloodstream. And now your body has to do something with it. Where does it go? Out through your kidneys. So if you have swollen ankles during the day and you're peeing all night, this salt-potassium imbalance is very likely your culprit. The solution? Increase your potassium intake dramatically. Avocados are absolutely loaded with potassium. 1 avocado has more potassium than 3 bananas. Leafy greens, bigger salads, these are potassium powerhouses. I also recommend a high-quality potassium electrolyte supplement, taken in the early part of the day, not at night. Trigger 2, blood sugar and insulin resistance. If you're diabetic, you already know this one. High blood sugar makes you pee, but here's what most people don't realize. You don't have to be diabetic for this to be a problem. Prediabetes and even just insulin resistance, which millions of people have without knowing it, will cause the same issue. Here's the mechanism. When there's too much sugar in your blood, your body desperately wants to get rid of it. It's toxic at high levels. So as that sugar passes through your kidneys and bladder, it pulls water with it through a process called osmotic diuresis. Sugar drags water. Where the sugar goes, water follows. So if you're eating sugar or starch, especially in the evening, you're literally programming yourself to pee multiple times that night, every single time. And here's the insidious part. This creates insulin resistance, which makes the problem even worse. It's that vicious cycle I mentioned earlier. Poor sleep causes insulin resistance. Insulin resistance causes high blood sugar. High blood sugar makes you pee at night. Peeing at night ruins your sleep. And around we go. Trigger 3. Vitamin B1 and magnesium deficiency. Now, this one is particularly important if you're experiencing a specific symptom. You wake up with an urgent need to pee, you rush to the bathroom, and then barely anything comes out. You're standing there thinking, that's it? That's what woke me up? This is usually a neurological issue related to the nerves that control your bladder. And the two nutrients most critical for nerve function related to bladder control are vitamin B1, thiamine, and magnesium. B1 has everything to do with the autonomic nervous system. That's the part of your nervous system that controls automatic functions like bladder control. But here's the key. B1 cannot work without magnesium. They work together as a team. If you're deficient in either one, the nerve signals to your bladder get confused. Your bladder tells you it's full when it's not. The urgency is real, but the actual amount of urine is minimal. This is also true for anything neurogenic or neurological related to bladder function. If there's a nerve component, think B1 and magnesium. For B1, I recommend a therapeutic dose, which is typically about 4 times what the bottle says. The standard recommended dose is meant for preventing deficiency, not correcting a problem. For magnesium, I specifically recommend magnesium glycinate, which is the form best absorbed and most helpful for nerve function. Trigger 4. Caffeine, the all-day saboteur. I love coffee. I'm not going to tell you to give it up entirely, but I need you to understand that caffeine is a diuretic. It makes you pee. And the problem I see with so many of my patients is that they're drinking coffee all day long. Morning coffee, mid-morning coffee, afternoon pick-me-up, sometimes even coffee with dinner. Every single cup is telling your kidneys to make more urine. Every single cup is working against that ADH hormone we talked about. The solution is simple. Have your caffeine in the morning. A cup or two? Fine. Enjoy it. But then stop. No more caffeine after noon, and ideally not after 10 a.m. if you're really struggling with nighttime urination. And remember, it's not just coffee. Tea has caffeine too. Even chocolate has stimulants that can have a diuretic effect. Trigger 5. Sugar and starch, especially at night. I've already mentioned how blood sugar causes you to pee, but this point is so important I need to emphasize it again with additional context. Sugar and starch, especially consumed in the evening, are absolutely devastating for nighttime urination. They spike your blood sugar, which triggers that osmotic diuresis, water following sugar out of your body. But there's another layer to this. Sugar and starch also deplete your potassium, so not only are they causing you to pee directly through the blood sugar mechanism, they're also making that salt-potassium imbalance even worse. It's a double whammy, and these carbohydrates are the primary drivers of insulin resistance, which, as we discussed, is at the root of so many of these problems. Trigger 6. Excess protein at dinner. This one surprises people. Protein is healthy, right? Absolutely, but timing and amount matter. When you consume too much protein, one of the metabolic byproducts is urea, and your body gets rid of urea by producing more urine. So if you're having a huge steak dinner, a massive chicken breast, or a giant protein shake at night, you're giving your body a lot of material that it needs to process and eliminate, and it's going to do that elimination while you're trying to sleep. This is why I recommend having most of your protein at your first meal of the day, maybe at lunch, and having a smaller, more moderate amount of protein for dinner. Trigger 7. Alcohol, the absolute worst offender. If there's one single thing, I could get you to change, it would be this. Do not drink alcohol before bed. Alcohol is the single biggest trigger for disrupting ADH. It absolutely devastates this hormone. It's a powerful diuretic, meaning it makes you pee, but it also directly interferes with ADH production and function. If you want to guarantee that you'll be up multiple times at night, just have a couple of drinks before bed. You'll be visiting the bathroom every hour like clockwork. I know this is a hard one for many people. A glass of wine at night is relaxing. It's a habit. It's social. But if you're serious about sleeping through the night, the alcohol has to go, at least in the evening. If you have challenges with reducing or eliminating alcohol, that's a separate issue that needs to be addressed. But for the purposes of nighttime urination, alcohol in the evening is non-negotiable. It has to stop. Trigger 8. Late night fluid intake. When is the worst time to drink fluids? The answer is later at night, especially within 3 hours of bedtime. Now, here's something fascinating that I've noticed both in my practice and in my own life. A lot of people, including myself, aren't very thirsty in the first part of the day, but we get increasingly thirsty as the evening approaches. I used to drink a ton of water at night. I thought I was doing the right thing, staying hydrated. But then I learned something that changed my perspective completely. That evening, thirst isn't necessarily dehydration. It's actually a survival mechanism. Your body is trying to make sure you have enough fluid on board because you're not going to be drinking for the next 8-12 hours while you sleep. It's your body's way of preparing for a fasting period. But if you respond to that thirst by chugging water right before bed, you're going to be up all night peeing it out. The solution is to front-load your hydration. Drink plenty of water in the morning and afternoon. By evening, you should be well hydrated enough that you don't need much, if any, additional fluid. Trigger 9. Nighttime snacking, the absolute worst habit. Out of everything I've discussed, if I had to pick the single most destructive habit for nighttime urination, it would be nighttime snacking. Here's why this is so devastating. When you snack at night, especially on carbohydrates and starches or salty things, several terrible things happen simultaneously. First, those carbs and starches spike your blood sugar, which, as we've discussed, causes you to pee. Second, they deplete your potassium even more, making that electrolyte imbalance worse. Third, salty snacks make you thirsty, so you drink more fluids late at night, compounding the problem. Fourth, eating late at night creates insulin resistance, which is the root cause underlying so much of this. And fifth, it disrupts your sleep quality even beyond the urination issue. Nighttime snacking is a killer. For most people struggling with nighttime urination, this is the habit that, when eliminated, creates the most dramatic improvement. Let me give you some perspective on what your kidneys are doing all day long. Your kidneys filter approximately 170 liters of fluid every single day. That's about 45 gallons. But here's the amazing part. Out of all that filtering, they only produce between 1.5 and 2 liters of actual urine. Everything else gets reabsorbed back into your body. This is ADH at work. This is your body carefully regulating water balance, deciding what to keep and what to eliminate. When ADH is functioning properly, your kidneys are incredibly efficient. They concentrate urine, they preserve water, they keep you in balance. But when any of those triggers we've discussed throw off ADH, that beautiful system breaks down and you start producing excessive amounts of urine, especially at night. All right, we've covered what's causing the problem. Now let's talk about the solution. This is the exact protocol I've used with thousands of patients over 35 years, and I'm telling you, it works. Step 1. Eliminate alcohol at night. This is non-negotiable. No alcohol in the evening, period. If you drink, do it earlier in the day, and even then, keep it minimal. Step 2. No fluids within 3 hours of bedtime. Get your hydration earlier in the day. Morning and afternoon, drink plenty. But 3 hours before bed, you're done drinking for the day. Step 3. No salty foods before bed. This means no chips, no pretzels, no heavily salted dinners. Salt is going to trigger fluid retention and nighttime urination. Step 4. Absolutely no snacking at night. This is critical. Your last food should be dinner, and dinner should be finished at least 3 hours before bed. No exceptions. This alone will transform your sleep. Step 5. Increase potassium dramatically. Eat avocados, leafy greens, and large salads. Take a high-quality potassium electrolyte supplement in the morning. This will help balance out the sodium and support proper ADH function. Step 6. Reduce caffeine and limit it to morning only. 1 or 2 cups of coffee in the morning is fine, but no caffeine after 10 a.m. None. This includes tea and chocolate. Step 7. Keep your carbs lower overall and absolutely minimize them at night. Reduce sugar and starch throughout the day, but especially in the evening. This will help with insulin resistance and reduce that blood sugar-driven urination. Step 8. Don't have large protein meals at night. Keep your protein portions moderate at dinner. Save the bigger protein servings for breakfast and lunch. Step 9. Take therapeutic doses of B1 and magnesium. For B1, take about 4 times the recommended dose on the bottle. You need therapeutic amounts, not just maintenance amounts. For magnesium, use magnesium glycinate, which is best for nerve and muscle function. Also continue with potassium supplementation. Step 10. Address insulin resistance. This is the underlying root cause for many people. Reducing carbs, eliminating nighttime snacking, and improving sleep will all help, but you may need additional strategies to fully reverse insulin resistance. I promise you, if you apply what I've just shown you, if you follow this protocol faithfully, you are going to sleep through the night, not maybe sleep better, not get up fewer times. You're going to sleep through the entire night. I've seen this work with patients who hadn't slept through the night in 20 years. I've seen 85-year-old patients who were convinced their age meant they were doomed to nighttime bathroom trips, and within a week, they're sleeping like they did when they were young. This works, but you have to actually do it. You have to make the changes. I know some of these changes might seem difficult. Giving up that evening glass of wine, stopping the nighttime snacking habit, cutting off fluids 3 hours before bed, these are real lifestyle changes, but I want you to think about what you're getting in return. Imagine waking up in the morning feeling truly rested for the first time in years. Imagine not having to stumble to the bathroom in the dark. Imagine not being exhausted all day. Imagine your metabolism working properly again, your mood improving, your energy returning, your mind clearing. That's what's on the other side of these changes. Your bladder isn't broken. Your prostate probably isn't the problem. You don't need adult diapers or surgery. You need to fix the hormone that controls nighttime urination. And now you know exactly how to do that. I'm Dr. Leonard Brooks, and I've given you 35 years of clinical experience distilled into this protocol. Now it's up to you to implement it. Sleep through the night. You deserve it. And when you do, come back and leave a comment to give other people hope that this really does work. Good night and sleep well.